Honorable and distinguished guests, participants to the World Hepatitis Summit, ladies and gentlemen, namaskar. In 1982, during an action sequence for a film that I was working in, I had an accident and I had to be hospitalized for almost 3 months. Blood transfusion was necessary to save my life, and among the 200 donors that came voluntarily forward, one of them was carrying the Australian antigen hepatitis B virus, which went into my system undetected. It was a fairly unknown virus then. This was 1982. In 2005, during a routine medical checkup, it was detected that 75% of my liver had been damaged by the hepatitis B virus, and that I was surviving only on 25% of my liver. Immediate treatment was begun, and I sit before you today because of the timely detection and cure procedures that followed. After 3 long decades battling this dreaded virus, I'm happy to join you, the worldwide community, in combating hepatitis. I'm also extremely pleased that the world has a new vision to eliminate hepatitis by 2030. This goal, envisioned by the World Health Organization's global strategy, is the best dream that I could imagine. But the question now really is how to make hepatitis elimination a reality for all. I'm delighted that delegates and leaders from around the world have gathered today to discuss precisely this question. And I'm sure that you will be able to bring out the best strategies we can use to achieve this universal ambition. A few months ago, the World Health Organization asked me to become their Goodwill ambassador for hepatitis in the Southeast Asia region. I felt it was an honorable duty to accept the invitation, and I'm deeply humbled by this appointment. In my region, viral hepatitis kills more than 400,000 people every year. 400,000 people every year. Nearly 90 million people continue to suffer from the disease as we speak. I believe awareness towards hepatitis and an access to prevention and treatment is the need of the hour. And if my face and voice can be of any help, I wish to align myself with any such campaign in the days to come. Earlier this year, the World Health Organization announced for the first time that there are more than 300 million people suffering from viral hepatitis B and C infections worldwide. This number has rung alarm bells around the world. Ignorance about hepatitis must now end, and people living with hepatitis must be provided with solutions. There is definitely more hope and despair in the fight against hepatitis, especially now compared to the time when I was diagnosed. Today, new generations are protected from hepatitis B through effective universal vaccinations. Hepatitis C can be cured within 2 months with over 90% effectiveness. Moreover, countries like mine are moving to implement the World Health Organization's plan to eliminate viral hepatitis by 2030. However, very few people in the need, that's about 10%, have access to hepatitis care. Allowing ignorance and inaction to continue will only lead to grave consequences. Every president, leader, and health worker must join us in fighting hepatitis. Powerful political decisions must be implemented to ensure that governments invest in viral hepatitis. Communities and societies need to become more educated and aware of the dangers of and solutions to viral hepatitis. I made my own resolution to become the face and voice of people living with hepatitis in my region. Many more faces and voices must come forward to mobilize this campaign to be heard globally. I wish you the most successful deliberations at the Second World Hepatitis Summit, and I do hope that the decisions made at this summit will bring us closer to realizing our collective dream of eliminating hepatitis much sooner. Thank you. Namaskar.